Poison control in California is about to lose all of its funding as part of our state budget crisis. We would certainly be out of business by September 2009, if not sooner, and those calls will go nowhere. People will hear nothing, or they'll get a busy signal and they'll have to decide what they're going to do on their own. There is a serious misconception in California by legislators and others that there's an alternative funding mechanism for poison control. That's simply not true. Losing funding for the poison control system in California will be a disaster for health care and all the people we serve.
I'm a poison information provider, so I take the home calls, which is about 80% of the calls that the Poison Control Center gets. Parents do call their pediatricians, and the pediatricians say, call poison control. People call the advice lines, and the advice lines tell them either to call the Poison Control Center or they conference us in. Sometimes people call 911, and 911 conferences the Poison Control Center in. At the emergency room, we're getting calls from the emergency room physicians.
The first time I called poison control was a couple of years ago when my son ingested some decorative berries. I wasn't sure if they were poisonous or not. I certainly knew that they weren't for consumption. So I gave poison control a quick call, and they were, in about a minute, they were able to ascertain that they were not poisonous at all, and Richie was fine. When I called California Poison Control, they asked me a series of questions, such as his weight and height and age, and the type of berry that he ate. And quickly they were able to determine that it was non-poisonous. It definitely made me feel better. It calmed me down right away. And the really remarkable thing is, about an hour later, they followed up with a phone call just to make sure that everything was okay. I'm already having a little bit of anxiety, given the fact that I've called poison control twice in 3 years, of not being able to use the service again. Poison control must be saved.
The California budget's in dire straits, and many programs are being cut, but it makes no sense to cut the poison control centers. This should be a top priority because the poison control centers save lives every day. But if the poison control centers shut down in California, we're just going to see thousands, I think tens of thousands of extra visits to the emergency rooms costing tens of millions of dollars.
Too many times in a budget situation like the one we face in Sacramento, we're too focused on the dollars and cents rather than the practical effect on people's lives. And the Poison Control Center has that kind of direct effect on people's lives. I don't want to get just focused in the dollars, because it's the service that's a value.
Poison control is very valuable in the sense that it's a resource for us to use anytime we have a question about an ingestion, an inhalation, an eye exposure. They're very valuable in terms of telling us exactly how to treat it, how long a person needs to be observed, and even if they need to come into the emergency department to be seen if they call from home.
So as an ED physician, do you use
As an emergency medicine physician, the closure of poison control will greatly impede my ability to see the numbers of patients I'm seeing at this time.
Perfect.
Okay.